also fortunate today to be here with some of the finest retinal specialists in the United States. I also think that the Macula Vision Research Foundation needs to be thanked for providing a great day of information for all of us. My topic, how can the low vision specialist help, is easily answered. The low vision specialist is the doctor that organizes the patient's vision rehabilitation program. Low vision, or a vision impairment, affects the way you see. It should not interfere with the way you live. And I know Mary Betty Roeder is going to speak on that extensively. 5 easily remembered questions will help all patients receive appropriate and necessary low vision eye care. Who, why, how, when, and what? Who should they see? Why is it necessary to see a different type of eye doctor? How can they help? When should you make an appointment with a low vision doctor? And what will be accomplished at the examination? Who is the low vision specialist? It's an optometrist or an ophthalmologist who is trained to evaluate your reduced vision, prescribe visual devices, and teach people how to use them. Notice how my first word was not sell. They do not sell optical or non-optical devices without first examining, demonstrating, potentially teaching the patient how to use the device, and loaning the device for home use. Why should you add another eye doctor to your list of doctors? If you're visually impaired and are being treated by an ophthalmologist or seeing an optometrist, and you ask them about low vision services or devices, and they say nothing more can be done, find a low vision specialist on your own. Call the County Association for the Blind. Call the state agency, the Bureau of Blindness and Visual Services. Go to a support group meeting, but find a low vision specialist. Not a doctor that does low vision, but a low vision specialist. How can these doctors help? A low vision examination takes hours, multiple visits. It requires a conversation between the doctor and the patient to decide on their goals together, realistic and attainable goals. The patient will be asked many questions about his visual functioning. Believe me, vision rehabilitation does not include a new pair of glasses alone. It incorporates optical devices, non-optical devices, and other vision rehabilitation professionals, such as rehabilitation teachers, orientation and mobility instructors, and occupational therapists. When should you see a low vision specialist? Before, during, or after your medical treatment? You should see a low vision specialist as soon as you are aware your vision is deteriorating. As soon as you notice a change in your functioning, in your lifestyle. What is done at this examination? Low vision is the loss of your best corrected vision caused by disease, injury, or heredity. Sometimes it means a decrease in vision and/or a decrease in visual field and/or an increase in light sensitivity, distorted vision, and possibly a loss of contrast. What will the low vision specialist do? Hopefully provide answers to your questions and explanations about your vision loss. They will recommend low vision devices that are task specific. I'd like to close with 2 statements. 1, never ever buy anything from a catalog without first being examined or receiving a recommendation from a low vision doctor. And second, every low vision patient is unique. They have different problems and different needs and different desires. So it's very important that somebody listen to the story that each low vision patient has. Thank you.